I grew up in Cincinnati, Ohio. I was one of three boys. I was the youngest. My father founded at the University of Cincinnati what was called the gastroenterology lab. And when I was about 11, I actually wrote something on jaundice, okay, and I actually gave a talk in grade school, but this was totally the influence of my father. So when I went off to college, I almost for sure knew I wanted to be a doctor. I went to medical school at Columbia University in New York, and I wasn't sure what field of medicine I was going to go into, although my father was very famous. He was the first president of the American Association for the Study of Liver Disease.
During the Vietnam War, Dr. Schiff trained as an epidemic intelligence service officer at the Center of Disease Control. He then completed his residency at University of Texas and Parkland Memorial Hospital with a fellowship in gastroenterology.
At that point in time, I sort of declared myself, I'm going into the same field that my father did. And that was great training. Then I was recruited, at that time it was 1969, to the University of Miami.
Here, Dr. Eugene Schiff would go on to make a mark on medicine that would change how the world treats liver disease, often working with his father, who joined the UM team a year after his son at the age of 70, up until his retirement in 1991. Schiff became the most recognizable name in hepatology in the world, and Gene Schiff continued to expand that legacy for decades.
Gene Schiff has been a member of the faculty at the Miller School of Medicine for 47 years. For 43 of those years, I've been here as well. He is a force of nature. There is no one who I have met in medicine who has such an all-encompassing knowledge and competence about one single field.
I got involved very early in hepatitis studies, cooperative studies, hepatitis related to drug abuse, hepatitis related to transfusions. I later got a big NIH grant that dealt with blood safety. At that time, they didn't yet have a marker for hepatitis of any kind, but they knew people who got transfused could get hepatitis. There was no vaccine. Shortly afterwards, a vaccine came out for hepatitis B, which I was very much involved in too.
Gene Schiff was a trailblazer. He established the first hepatology section at the Miami Veterans Administration Medical Center.
I met Gene as a student about 30 years ago on his service at the Miami VA, and I was anticipating somebody who was extremely knowledgeable in liver disease and could teach me a lot, which he did, obviously. But what really impressed me the most was the kindness, the compassion.
In 1990, Dr. Schiff founded the Center for Liver Diseases at the University of Miami and later dedicated it to his father, renaming it the Schiff Center for Liver Diseases. Here, Dr. Schiff and his researchers have made enormous strides to treat, prevent, and better understand illnesses related to the liver.
He's an icon in medicine. Like his father before him, he represents the brain trust for liver disease at the Miller School of Medicine. The two of them, Schiff and Schiff, have written the definitive textbook on liver disease.
What's coming out is the 12th edition of Schiff's Disease of the Liver. I saw, going from a time when they didn't even know that there were all these hepatitis viruses to a time where we've identified A, B, C, D, and E. And by the way, E we do in our lab and no one else is doing it in the state of Florida. But now we can cure most of them.
He continues to see patients to this day, including mine. We were reluctant to treat patients with hepatitis C until about 4 years ago because the treatment was awful. The new drugs, which Dr. Schiff was critical in helping to develop, are now a pill a day, virtually no side effects, 12-week treatment, 90 to 100% cure rate. This is a major turnaround in medicine, for which he deserves an enormous amount of credit.
What anybody involved in research wants to do is what's called translational research. So it means to do something at a bench level in a lab that hopefully will translate into something that's clinically applicable. So what I'm proud of is, number one, is establishing a resource that either directly or indirectly can help anybody who either has a hepatobiliary disorder or is a doctor who takes care of them.
He really had set the standard on how to treat liver disease. He spent a lot of time working on the cure for hepatitis C, and so these are some of the legacies he will leave behind. I don't know when that behind will occur.
I'll retire when the man up above takes me. Why? I like what I do, I really do. I've gotten a lot of awards, but it means a lot to me to have awards that come from the community I live in, and I mean that. Anytime you get an award like this, you're really a symbol of many unsung heroes that you would be nothing without them. I represent a whole army of people, each of whom played an important role in accomplishing something good.
The Greater Miami Chamber of Commerce, AXA Advisors Healthcare Heroes Lifetime Achievement Honoree, Dr. Eugene Schiff.